Good evening. It's Thursday, January 30, 2020 here in Cebu City. I'm Cherry Ann Lim, and here's all you need to know in NewsBits tonight. The Department of Health has confirmed the first case of the 2019 novel coronavirus in the Philippines. Here's Chari Coronel for the details.
The Department of Health confirmed on Thursday afternoon the first case of 2019 novel coronavirus in the Philippines. The patient is a 38-year-old female from Wuhan, China, who arrived in the country last January 21. Health Secretary Francisco Duque III said the patient was admitted in one of the government hospitals in the country last January 25 after experiencing mild cough. They, however, refused to name the hospital.
We are working closely with the hospital where the patient is admitted and have activated the incident command system of the said hospital for appropriate management, specifically on infection control, case management, and containment. We are also implementing measures to protect the health staff providing care to these patients.
Duque said the result of the laboratory test done on the patient arrived today from the Victorian Infectious Disease Reference Laboratory in Australia.
We were able to detect the first confirmed case because of our strong surveillance system, close coordination with the World Health Organization and other national agencies, and the utilization of DOH's decision tool or the evaluation assessment tool.
As of January 30, the Health Department has recorded a total of 29 persons under investigation for 2019 nCoV. Of the 29, 18 are in Metro Manila, 4 in Central Visayas, 3 in Western Visayas, 1 in Mimaropa, 1 in Eastern Visayas, 1 in Northern Mindanao, and 1 in Davao. A total of 23 patients are currently admitted and 5 have been discharged but still under strict monitoring. 1 patient also reportedly died, but it has not yet been confirmed whether the cause was the 2019 nCoV, as he was also found to be positive for HIV. The Health Department assured the public that all necessary precautionary measures are being taken to stop the spread of the virus.
Finally, I urge the public to stay calm and remain vigilant at all times. Let us continue to practice good personal hygiene and indeed adopt healthy lifestyles. Thank you.
Chari Coronel, NewsBits Tonight.
Following calls to ban Chinese tourists amid the threat of the 2019 novel coronavirus, Cebu Governor Gwendolyn Garcia has ordered a 14-day quarantine of all passengers from China arriving in Cebu. Here's Kenneth Torres for the details.
Governor Gwendolyn Garcia on Thursday afternoon ordered the 14-day quarantine of all passengers from China arriving in Cebu. Garcia's order came following calls of some local chief executives to ban the entry of Chinese nationals in Cebu amid the threat of the 2019 novel coronavirus. The governor said during a meeting with different government agencies this afternoon that she was not in favor of banning Chinese tourists in the province. Instead, a task force will be formed to lead the inspection and monitoring of the course of tourists. Cebu's Chinese Consul General Jia Li yesterday said there is no reason to ban the entry of Chinese tourists. Li said countries like the United States of America, Japan, and Germany did not impose any ban on Chinese tourists, despite having confirmed cases of the 2019 novel coronavirus. The Consul General assured that the Chinese government is doing its best to contain the infectious disease. As of January 30, the Health Department has recorded a total of 29 persons under investigation for the 2019 novel coronavirus. A total of 23 patients are currently admitted, and 5 have been discharged but still under strict monitoring. One patient also reportedly died, but it has not yet been confirmed whether the cause was the novel coronavirus, as he was also found to be positive for HIV. Kenneth Torres, NewsBits Tonight.
More stories in NewsBits Tonight after this short break. The National Economic and Development Authority Board has approved the fourth bridge project linking mainland Cebu and Mactan Island. Here's Nico Tubo for the details.
The proposed 76 billion peso fourth bridge project linking Cebu mainland and Mactan Island has been approved by the National Economic and Development Authority Board. The fourth Cebu bridge is among the 8 projects given a green light by NEDA Investment Coordination Committee. The NEDA said the project aims to improve the capacity of the existing road network in Cebu and facilitate faster movement of trade, people, and convenience in Metro Cebu. The project involves construction of a 3.3-kilometer bridge with an elevated viaduct of over 3 kilometers, with 2 lanes in each direction. It also includes the construction of a 4.9-kilometer 4-lane coastal road with more than 4 kilometers of elevated viaduct. Interchanges will also be constructed at the linkage between the 2 projects in Mandawi City. Socio-Economic Planning Secretary Ernesto Pernia said they intend to roll out as many projects as they can to ease congestion and spread growth throughout the country. Nico Tubo, NewsBits Tonight.
For the latest in sports, here's Kenneth Torres.
PBA D-League star Eliud Poligrates can now breathe a sigh of relief after the court dismissed the violence against women and children complaint filed by his ex-girlfriend Lucille Alusada Trazona. Trazona has signed an affidavit attesting that there was no physical altercation between her and Poligrates. Trazona admitted that she incurred no physical injuries in relation to the incident. Poligrates said he feel happy over the development as it means he can now play with Marinerong Pilipino in the D-League. Poligrates added that after getting released from jail, he approached the team but the management refused to accept him. The former Southwestern University star will now join the practices of Marinerong Pilipino for its D-League campaign on February 12. Kenneth Torres, NewsBits Tonight.
To get the latest, visit www.sunstar.com.ph. Follow us on our YouTube channel and official social media accounts on Twitter and Facebook. I'm Cherry Ann Lim. Good evening.